Hello, my dear doctor. Right, so I'd like to discuss also the ulcerative colitis management here. Treatment can be divided into the inducing and maintenance remission. NICE released the guidelines on the management of ulcerative colitis in 2013. So the severity of the ulcerative colitis is usually classified as being mild, moderate, or severe. Mild, less than 4 stools per day, only a small amount of blood. Moderate, 4 to 6 stools per day, varying amounts of blood, no systemic upset. Severe is greater than 6 bloody stools per day plus features of systemic upset, pyrexia, tachycardia, anemia, and raised inflammatory markers. So yes, once again, I'd like to read also, right, according the True Love and Wheats criteria of classification of ulcerative colitis. Yes, once again, the severity in the ulcerative colitis, True Love and Wheats criteria modified to include the CRP. So variable features, right, the motions per day, mild less than 4, and moderate 4 to 6, and severe greater than 6. So circle the greater than 6. Rectal bleeding small, moderate, and large, and temperature at 6 a.m. there is apyrexial, and in moderate 37.1 to 37.8 degrees centigrade. In severe ulcerative colitis is greater than 37.8 degrees centigrade. Resting pulse in case of mild there is less than 70 beats per minute, and moderate 70 to 90 beats per minute, and severe is greater than 90 beats per minute. Hemoglobin in case of mild greater than 110 gram per liter, in moderate 105 to 110 gram per liter, and in severe less than 105 gram per liter. And ESR do CRP2. Yes, this is very important. Less than 30, and in case of mild and severe, greater than 30, and in case of CRPs, less than 16 in mild might be better, but is greater than 45. CRP is greater than 45, so circle. So 6 in case of severe, so we need to know the severe most, so circle the 6 greater than 6 as well as the CRP greater than 45, it will be helpful. Along with that, you see the pulse, temperature, hemoglobin level, and as well as the rectal bleeding, we can understand. But must remember the motions greater than 6 and CRP greater than 45. Yes, my dear, just follow me what is written inducing remission in your notes. Treatment depends on the extent and severity of the disease. Rectal topical aminosalicylates or steroids for distal colitis. Rectal mesalazine has been shown to be superior to rectal steroids and oral aminosalicylates. So circle, my dear, distal, circle rectal mesalazine. Oral aminosalicylates and oral prednisolone is usually used as the second line for patients who fail to respond aminosalicylates. So circle the prednisolone, circle the second line. NICE recommend waiting for 4 weeks before deciding if first line treatment has failed. Severe colitis should be treated in hospital. IV steroid, intravenous steroid are usually given the first line. Maintaining remissions. Oral aminosalicylates, once again the mesalazine, azathioprine, and markaptopurine. Methotrexate is not recommended for the management of ulcerative colitis in contrast to the Crohn's disease. There is some evidence that probiotics may prevent relapse in patients with mild to moderate disease. So mind you, just look at the board, the SS box will be helpful. Let's talk about more. So once again, the SS box. Yes. Ulcerative colitis. In ulcerative colitis, the first line we're writing inducing treatment. Once again, just writing down the inducing treatment. Inducing treatment of the ulcerative colitis, just write it down. You see, yes. So we can write the ulcerative colitis treatment. UC means, yes, the U means, if I make it O, all right. oral. Once again, the oral mesalazine. Just write it down. Oral mesalazine. And C stands on, once again, C stands on oral corticosteroids. Yes, once again, C stands on oral, yes, corticosteroids. Yes, my dear, just write it down. Ulcerative colitis, you see oral mesalazine. I'm writing U for oral mesalazine and C for corticosteroids. A single box, right, which will be helpful for the distal colitis. The word the distal should be the topical treatment, means the topical means the rectal. Rectal. It is said that the distal colitis, the rectal mesalazine, yes, the mesalazine is better than rectal steroids, is better than rectal steroids. And even the oral mesalazine is said that. So topical rectal treatment means the rectal mesalazine is the treatment for the distal colitis. So write it down. And ulcerative colitis, once again, just write it down the box, my dear. So this is very important. It's said that the oral mesalazine, once again, before going to the oral mesalazine, it's said that the rectal or topical aminosyloses or topical or rectal, yes, we can write here, topical or rectal mesalazine or steroid means the corticosteroid. We can write the mesalazine and corticosteroid. Yes. Is the first line, and then the second line treatment is the oral corticosteroids, and it's written the 4 weeks before going to the second line treatment. Just make a box, and this box will be helpful, my dear. And in case of severe colitis, it's said that in case of severe colitis, that the IV corticosteroid. IV corticosteroids in case of severe. So write down the severe. Severe means, I said the severe means S for 6, and severe means CRP. Once again, just remember SS or SRP, CRP, no problem. CRP greater than 45. So this is the criteria for the severe. IV corticosteroid should be given. Next part is the B, is the maintaining treatment. If you write here the maintaining treatment here, so here's the B for maintaining treatment. So the maintaining treatment are also the oral mesalazine, oral mesalazine, oral mesalazine, and also it is written that the markeptopurine, azathioprine can be used for the maintenance treatment. After that, oral mesalazine. All right. But the most important thing, the MTX is cross here, cannot be used. All right. Just write it down. And is written plus mild to moderate disease, some role of probiotics having a role, all right? Maintenance treatment. I'd like to discuss a little bit so we can understand and easily can get them. Alright, so the treatment of ulcerative colitis, my dear, yes, let me start. Right, the treatment ulcerative colitis is nothing but the UC means the oral. You see the oral, alright. UC for corticosteroids, the most important treatment here. Yes, corticosteroids, you see. UC means the oral mesalazine or the topical or rectal mesalazine or corticosteroids is the first line treatment. Is the first line. We can write this is the first line. This is the second line treatment. So the first line treatment, it is said that for the distal colitis, the topical or rectal mesalazine is better than steroids, even better than rectal steroids, even better than oral mesalazine. So the first line treatment is the oral mesalazine, or we can use the topical mesalazine or corticosteroid. Means the rectal corticosteroids or rectal mesalazine. Or in the first line, we can use the oral mesalazine also. Yes. But for distal group, the topical treatment is more better. If it is proximal disease, then you can use the oral. If the distal disease, you can use the rectal. Yes, you can understand. So yes, once again, so the first line treatment for the distal group of, there is the topical steroids or once again the topical mesalazine. As because it said that the mesalazine is better than steroids, so mesalazine once again. But in proximal, more proximal, not the distal, yes, once again, it is said the oral mesalazine, once again, oral mesalazine is the first line treatment. If it is not controlled after treatment having the 4 weeks, you see the 4 weeks, it will come up in your exam. The second line treatment is the oral corticosteroids to induce the remission, my dear. To induce the remission, yes. And in case of severe, if it is not controlled, right, the severe means S means 6, means greater than 6 motion a day, and CRP greater than 45, along with, remember, the hemoglobin, temperature, and tachycardia. So low hemoglobin, temperature, and tachycardia. Yes, so we can write the HBTT are the other features of severe in true love and which criteria that we have seen. All right, we have already read them all together. So yes, once again, the IV corticosteroids is the treatment of choice. Next treatment is the maintenance treatment. Maintenance treatment, once again, the AM rule. Yes, we know that AM rule. But methotrexate is not used. In contrast, you see the Crohn's disease, the methotrexate we are using as a second line treatment, but the methotrexate has no role in ulcerative colitis management. And mild to moderate disease, yes, mild to moderate disease, we can use some of the probiotics. Yes, some of the probiotics having the role. So you see the maintenance treatment, we have the mocking, stop mocking, MC, markaptopurine, as well as the azathioprine is the first line. Same thing is the markaptopurine or azathioprine is the first line. The methotrexate is not used, all right? These are differentiating points here. Yes, my dear. So severe ulcerative colitis, if unwell and grade equal or greater equal, right, the 6 motions per day, admit for nil by mouth and IV hydration, like the 1 liter of 0.9% saline plus 2 liter dextrose saline in 24 hours, plus 20 millimole potassium K plus per liter for maintenance, less if elderly. So treatment should be started like the hydrocortisone, that the 100 milligram per 6 hour intravenous. Rectal steroids, hydrocortisone 100 milligram in 100 ml, 100 ml, 100 milligram in 100 ml in 0.9% saline per 12 hours per rectal. Monitor temperature, pulse, and BP, and record the stool frequency character on a stool chart. twice daily exam, the document, the distension, bowel sounds and tenderness. Daily write FBC, ESR, CRP, urea electrolytes with or without abdominal X-ray, AXR. Consider blood transfusion if hemoglobin less than 90 to 100 gram per liter. And B, day 3, CRP greater than 45 or bowels open greater than 8 times a day. 85% chance of colectomy on this admission. Parenteral nutrition is only very rarely required if severely malnourished. If improving in 5 days, transfer to prednisolone per oral, that is 40 mg 24 hours with a 5 amino salicylic acid, that is sulfasalazine 500 mg per 6 hours to maintain the remission. If on day 3 CRP 45 greater than 45 and or greater than 6 stools per day, so circle the 45 and 6 stools CRP, action is probably needed, colectomy or rescue therapy with cyclosporin or infliximab, which can avoid urgent colectomy in steroid refractory patients. The need for elective colectomy in the long term is not modified. Surgery, this is needed at some stage in 20%, proctocolectomy plus terminal ileostomy. It may be possible to retain the ileocecal valve and hence reduce liquid loss. Colectomy with ileoanal pouch later. Surgical mortality 2 to 7% higher in perforation, and pouchitis can improve with antibiotics like the metronidazole plus ciprofloxacin for 2 weeks and immunosuppressant. So indications of surgery, the box is written in your notes that the perforation, massive hemorrhage, toxic dilatation and failed medical therapy. My dear, now just look at the box right here. So this is the ulcerative colitis and this is the Crohn's disease. So whatever the Crohn's disease and ulcerative colitis, I'd like to give a box here. That is, we can write the acute colitis. Acute colitis. Usually acute colitis happen in the ulcerative colitis more. So yes, the acute colitis, after having the resuscitation, all them to the most important treatment is the IV. Colitis means corticosteroid. IV corticosteroids. IV corticosteroids is said that, right, if the IV corticosteroids is not controlled, then the second step of the treatment is the IV cyclosporin or infliximab. So can you remember the infliximab? MAB is the treatment of Crohn's disease. Remember this. Separate box. Yes, my dear, if it is not controlled with the IV cyclosporin, yes, the number 3 treatment is the surgery. It is said that surgery indications, right? Indications of surgery in case of ulcerative colitis, in case of Crohn's disease. We are writing the ulcerative colitis, we are writing the Crohn's disease. In case of ulcerative colitis, my dear, just remember the medical therapy means the failed medical therapy. Just write it down. The failed medical therapy. So failed medical treatment, it is said that day 3 plus greater equals 6 or greater than 45, CRP greater than 6. Yes, the 6 stools per day, the motions, right? So we should go for surgery. So this is the number 1 indications. Along with, yes, the hemorrhage and perforations. Just write it down, hemorrhage, perforation. And also the toxic megacolon. Is an indications for going for the surgery. But in case of Crohn's disease, this is very important. In case of Crohn's disease, there is the Yes, the same thing, the failed medical therapy, the same. But along with that, the most important indications of Crohn's disease surgery are remember, the fistula, adhesion, all right, then the strictures, so just write it down, and perianal diseases all together. So this is a very important box, my dear. I'd like to discuss a little bit more, all right, so that the IV corticosteroid as well as the cyclosporin, and then going for surgery, all right, going for the surgery, we can get them, all right. Along with that, a little bit need that because of this colitis, acute colitis, inflammatory bowel disease, is a risk to develop the thrombotic disorder. So we need to add, just write it down, we need to add all them, that is the low molecular weight heparin subcutaneous as a thromboprophylaxis, all right, just write it down. So this is a separate box, right? SS box, access colitis. And here's the acute colitis, the treatment of corticosteroid, cyclosporin, and infliction in case of Crohn's disease, cyclosporin, and surgery, that is ulcerative colitis. I am saying the failed treatment, hemorrhage, perforation, and toxic megacolon. So this is the box, and next is the first box, that is the fistulating disease, adhesion, strictures, fistula. Yes, these are the indications of Crohn's disease, indications of surgery. So we can make a box of them together. Yes. So the summary talk, my dear, this is very important summary. Very important summary, starting with the Crohn's disease management, also the ulcerative colitis management. So Crohn's disease, the summary, the CDM, and ulcerative colitis is nothing but the ulcerative colitis is nothing but the CCC. Yes, C. C is the treatment. So here is the not the CDM, rather it's a treatment is the CM. We can write the CM also here. This is important, right? So the summary talk. And as is both the acute colitis, the corticosteroid, then cyclosporin in case of ulcerative colitis. Feel it, this is ulcerative colitis, all right, the acute colitis. And the surgery ulcerative colitis, yes, these are the indications. I hope that is, my dear, the summary box of the CD for CDM and ulcerative colitis for CM, UCM, all right, no problem. CDM and UCM that we need to remember so that we can go through and get all the features here. And we'll do the best. Thank you very much, my dear.